in spring of 2017, we were having an event called Give Kids a Smile. And that's where we bring in children from Head Start programs and we provide dental screenings to them, polishing of the teeth, and fluoride treatments. So during that event, Marcia Toomey, who's with MCCP, approached one of the other faculty members and myself, and she said, "What do you guys do with this clinic when this isn't going on?" And we said, well, we have patients come in for the students because they have to learn how to, work on real patients in order to get their education and their graduation requirements. So Marcia had a light bulb moment and she said, well, why don't we see if we can partner with Fairfax County Public Schools and MCCP and NOVA, and that way the students can fulfill their requirements for pediatric patients while helping the community.
We're going to walk in line to board the bus. Little ones go in the front, the older ones go in the back.
It's framed for them as a field trip, to the dentist, so it's really a lot of fun for them. And then it's a very non-intimidating environment for them. It's not like a regular dental office. They're coming with their friends, they're coming with their siblings.
You can follow me.
After we sat the patient, they gave us their medical history.
Medical history is very important to take a look at because it helps us determine the process of care that we need to do.
It's always important to make sure that we know that we can safely do all of the things that we want to do and that there's no complications or special precautions that we need.
And then we started with what we call the EOIO, intraoral, extraoral examination.
Just to make sure that everything was within normal limits and nothing stood out to us or something that looked concerning.
I like the circular motion.
Then we do oral health instruction, so we go over best practices for brushing and flossing and how to do it if they don't know how to do it, that sort of thing.
Make sure you're brushing upwards to get the whole back of the tooth, you see?
What about on the front?
The front, it should be angled, kind of like this.
Then we do an actual professional cleaning, so that involves debribing any calculus and also a polishing, and we do fluoride as the last step. Somewhere during that process, the doctor comes over and she'll do an exam and basically give them a rating on how much, if any, work they need and the severity of the need. And then I think the program, the MCCP program, they then use that info to help get the actual restorative work done.
Okay, when we brush, we want to be kind of gentle. Because what happens if you brush so hard that it hurts?
We want them to like going to the dentist as much as possible because it's important. So we have a lot of fun with it and the kids seem to have a really good time, and I had a great time.
2, 3.
Clean teeth!
It was amazing. I never had the opportunity to work with kids like that. At the end, she gave me a hug and she was saying that she didn't want to leave. So I thought that was the best feedback I could ever gotten.
I was telling, Ms. Dudley, the clinic coordinator, how excited I was to have the opportunity of doing something like this. I just felt like it was a way of us giving back to the community.
A while back when I was at the school level, I met a little girl. We didn't know why she was always distracted or absent. The real issue was that she had an awful cavity. We were able to take care of the cavity and she was attending school regularly after that. That's our most important goal, that they be at school learning.
Currently, I know there are probably about 20, maybe even 30 other schools on a waiting list right now to come in. The goal is to do more in terms of just access to care. If we could do this more, I would love it.
We work with really young kids, 6 to 8, sometimes 10 years old, and they're not always thinking about what they want to be when they grow up, but if we could spark some sort of passion for oral health and maybe they want to be a hygienist, maybe they want to be a dental assistant when they grow up or a dentist, I really think we've had a lot of impact showing these kids, look, you can do this.